Good evening. Today is September 11th, 2019. It is 5:30. As a quorum of the board is in attendance, I'd like to call to order the first public hearing of the Central Health Board of Managers regarding the district's fiscal year 2019 budget and its associated tax rate as required by Chapter 26 of Texas Tax Code.
Dr. Zamora, I'm so sorry to interrupt you, but you said 2019, and it's actually for the 2020.
Okay, sorry, we can just change that. 2020, regarding the district's fiscal year 2020 budget and its associated tax rate as required by the Chapter 26 of the Texas Tax Code. Sorry, Holly, sorry. 18 years ago today, 2,996 people were killed and more than 6,000 others were injured in the deadliest terrorist attack in the history of the world. The coordinated attacks on the World Trade Center in New York, the Pentagon in Washington, D.C., and in Pennsylvania touched us all in a profound way. Known universally as simply the attacks on 9/11, we pause to remember the civilians, firefighters, law enforcement officers, military personnel, and the flight crew members who died that day, along with their families and loved ones and their survivors, and who still suffer 18 years later. Please join me in a moment of silence to reflect on this incomprehensible loss of life on that day and since, and remember those still grieving today. Thank you, everyone. Agenda item 1, present an overview of the proposed Central Health fiscal year 2020 budget and its associated tax rate, and receive public comment concerning the proposed budget and tax rate. We'll begin with staff presentation by Lisa Owens and Melanie Miller. Thank you.
Thank you, Lisa Owens, Vice President of Financial Operations, and we're going to give you a very brief presentation. I'll turn it over to my colleague.
Hi, I'm Melanie Miller, Budget and Financial Analyst for Central Health, and I'm going to walk you through some of the property tax information. As we've discussed, the FY 2020 proposed tax rate is 6.9% over the no new revenue rate, which is the rate that would generate the same comparable revenue as the prior year. In looking at the average taxable homestead value, which is estimated to be approximately a little under $348,000, this new proposed tax rate would create a tax bill just for the Central Health portion of $367.03, and that would be an increase of $23.07 over the prior year, approximately 6.7%. Our property tax rate is comprised of two pieces: the maintenance on operation rate, which is 10.4906 cents per $100 of valuation, and the debt service rate, which is 0.0667 cents, for a total rate of 10.5573. Now, the Travis Central Appraisal District has created a website, and you'll see the link there at the bottom of the slide, travistaxes.com. And for taxpayers who want to find out more about the other property tax rates that affect their residents, they can go there and enter their residence. They should have received a postcard for that today or perhaps tomorrow that will give them instructions on how to do that. So it's very informative and provides transparency in the property tax process. Just as a reminder, our homestead exemption for Central Health is 20%, the maximum allowed by state law, and we also have an exemption for people over 65 or who are disabled that's $85,500. Moving on. So what this means, we've created this slide just to show the impact on various tax bands within our properties in Travis County, and I'll just walk you quickly through the first one. For a home that was valued at $150,000 in last fiscal year, the average tax bill would be approximately $127 for the Central Health portion. Now, we anticipate that home has appreciated 7% since last year, which would give you a new homestead value in 2020 of $160,500. And looking at the net taxable value, that would generate a tax bill of $136, or an increase of $9, which is about a 7% increase. So very minimal in some respects.
Thank you. So I will hit the highlights of the budget. We have presented this information numerous times, and I want to also remind everyone of the budget booklet, which has a wealth of detail, narrative, and additional schedules or spreadsheets that have more details. But we will focus on our sources and uses in the proposed budget. Our total proposed sources and uses are $290.8 million. Over $214 million in property taxes are anticipated in our 2020 budget. That is approximately an $18 million increase over last year. We also have sources of funds that come from lease revenue for properties that we ground lease primarily at the Central Health Downtown Campus, as well as interest revenue and tobacco litigation settlement. We anticipate carrying forward a contingency reserve for healthcare uses, which we use as a source of funds of $56.5 million, and again, a total of $290.8 million sources of funds. And then on our uses of funds, we have an estimated $278 million in healthcare delivery, and then $10.9 million in administration, and about $1.9 million in tax collection. Over 96% of our uses of funds do go to our healthcare delivery program, and again, approximately $290.8 million in uses of funds. We also carry an emergency reserve to ensure that we have adequate resources, and we anticipate that being approximately $38.7 million for the fiscal year. As I mentioned, our budget booklet has a wealth of information. We also have additional information on our website. We have posted all of the meetings that we have held regarding the budget process. You can go back and review those. And as Melanie mentioned, a great transparency tool, the Travis Taxes website is available for all of the taxpayers. So thank you very much.
Thanks. We have now reached the time to receive public comment on the proposed fiscal year 2020 budget and its associated tax rate. Anais Cruz, the Central Health Communications and Community Engagement Program Manager, will present the guidelines for the public hearing and will introduce the speakers in the order they signed in. Thanks.
Hi, good evening. My name is Anais Cruz, Program Manager here at Central Health. I'm going to read the process and guidelines and jump into our list of speakers. For the purpose of citizens' communication and public hearings held during the course of Board of Managers meeting, the board will follow the guidelines set out below. Number 1, any person may speak during citizens' communication portion of any Central Health Board of Managers meeting at which citizens' communication appears on the agenda and during any public hearing that is posted as such. Number 2, in advance of speaking, an individual must complete a sign-in sheet that includes the person's name, address, and organization being presented if applicable. At the individual's option, he or she may provide a telephone number and email address. Number 3, the chairperson or preceding officer will call speakers in the order in which they are listed in the sign-in sheet. Number 4, each speaker has a limit of 3 minutes. Number 5, each speaker may address the board only one time during any particular citizens' communication or the particular public hearing. Number 6, a speaker may not donate his or her 3 minutes or any part thereof to another speaker. Number 7, a speaker does not have the right to speak if he or she signs in after citizens' communication or the public hearing is closed. The hearing will be closed once the last individual who has signed in has spoken. Number 8, depending on the number of persons wishing to speak, the chairperson or preceding officer may, in his or her discretion, impose additional procedural guidelines on the time and or manner of speaker's presentation to ensure the efficient and effective conduct of the meeting. Due to the restricted nature of the Open Meetings Act and to fulfill proper notice of the meeting requirements, the board is restricted from discussing any item that is not posted on the agenda for that meeting. Therefore, the board may not may be unable to address your comments, and thus citizens' communication is most usually a one-way communication vehicle. However, a Central Health staff member may follow up with you regarding the topic of your communication as appropriate. And with that, I will introduce Vanessa Fuentes.
Hi there, good evening. My name is Vanessa Fuentes, and I'm a resident of Southeast Austin, and I'm here today in solidarity with my neighbors in Del Valley. And as you know, my neighbors have been long advocating for a health clinic in Del Valley area. And as someone who works in community health advocacy, it saddens me to say that people who live on the west side of the county have a life expectancy of 10 years longer than those who live on the east. So there's an urgent need to provide critical health services to Southeast Travis County. Central Health's 2020 strategic objectives are stated as saying developing and executing health delivery based on people and place and implementing patient focus and coordinated health. We know that parts of Southeast Travis County have high levels of families living in poverty, and the urgent need exists for us to provide care to those who are most at risk. As you deliberate the Central Health budget, please prioritize and ensure that funding is equitably distributed, especially to those who have been long neglected and underserved. I ask that you look closely at the current proposal of $1.15 million for the Del Valley Health Clinic, the one on Elroy or near Elroy Road, and look at it through a lens of equity. Is $1.15 million sufficient to build, operate, and administer healthcare services? Further, I ask you to prioritize and expedite the development of this healthcare clinic, and that you set a date as soon as possible. The health of Southeast Travis County depends on it. Thank you.
Thank you for this.
That concludes our list of speakers for today's public hearing.
Thanks, Elise. And as chair, I'd like to take this time to recognize our commissioner, Commissioner Doherty. Thank you for coming and joining us, Commissioner. We'll see no other speakers. I need to announce the date, time, and place of the meeting. The Central Health will vote to adopt the fiscal year 2020 budget and its associated tax rate, and confirm the date, time, and place of the second public hearing on the proposed fiscal year 2020. The second public hearing, held in accordance with Chapter 26 of the Texas Tax Code, and the board vote on the adoption of the fiscal year 2020 budget will be on Wednesday, September 18th, 2019, at 5:30 p.m. The meeting in which the Central Health Board of Managers will vote on adoption of the fiscal year 2020 tax rate will be held on Wednesday, September 25th, 2019, at 5:30. These meetings will be held at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, we're going to stand down for a minute, and you can get some food next door. We will resume the next meeting at 6 o'clock. All right, agenda item 2, announce the date, time, and place of the meeting at which Central Health will vote to adopt the fiscal year 2020 budget and the associated tax rate, and confirm the date and time and place of the second public hearing on the proposed fiscal year 2020 tax rate. The second public hearing, held in accordance with Chapter 26 of the Texas Tax Code, and the board vote on adoption of the fiscal year 2020 budget will be on Wednesday, September 18th, 2019, at 5:30 p.m. The meeting at which the Central Health Board of Managers will vote on adoption of the fiscal year 2020 tax rate will be held on Wednesday, September 25th, 2019, at 5:30 p.m. These meetings will be held at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. I'm ready to accept the motion to close the first public hearing.
I move to adjourn the first public hearing.
A motion by Manager Greenberg, seconded by Manager Mosaitis. Any, all in favor, say aye.
Aye.
Against, okay. We stand adjourned. All right. We will now convene the meeting of the Central Health Board of Managers for our regular board meeting agenda. The first, do I need to read the time?
Yeah,
Okay. Today is August 11th, September 11th, 2019. It is 6:01. I'm ready to convene the meeting of the Central Health Board of Managers for our regular board meeting agenda. The first item of business is citizen communications.
We have no speakers signed up for tonight's citizens communication.
Thank you. I'd like to take a note for the record. Agenda item 5 will not be discussed this evening. That item is agenda item 5. The potential property for Commissioner Lee in the downtown county. I'd like to note for the record we will take the consent agenda. C1, approve the minutes of August Central Health Board of Managers. Do I hear a motion?
Second.
Here, I have a motion by Manager Jones, seconded by Manager Bell. All in favor say aye.
Aye.
Okay, motion passes. Regular agenda, agenda item 1. Receive and discuss a presentation on the proposed Central Health and Community Care Collaborative fiscal year 2020 budget, including the fiscal year 2019 end of year estimates and ongoing budget strategies. And number 3, receive and discuss a presentation on Central Health capital improvement program, including debt finance fund instruments. Ms. Owens. Ms. Owens will be presenting both items.
Okay, good evening. I want to provide a brief presentation on the proposed budget. We just presented this at our public hearing. However, I will reiterate at a very high level that we are proposing a tax rate of 6.9% over no new revenue. That is 10.5573 cents per $100 of valuation. And on the average taxable homestead value, comparing the average taxable homestead value from last year to this year, we estimate that to be approximately an annual increase of $23.07. A reminder of our homestead exemption, which is 20%, maximum allowable by law. And also a reminder that TravisTaxes.com is live, which has a wealth of information about all of the taxes in Travis County. In addition, I will walk through our sources and uses again. We are proposing $290.8 million in sources and uses, predominantly tax revenue at $214.9 million in tax revenue of the $290.8 million in sources of funds, and our uses of funds, $278 million in healthcare delivery, $10.9 million in administration, and just under $1.9 million in tax collection. Again, for total uses of $290.8 million, and our healthcare delivery being over 96% of those uses. I'm going to move on to item 3. I think we're taking those both up together. Okay, so item 3 is a discussion of capital improvement program and debt financing instruments. So as we have shown in the past, we do have capital reserves, and each year we do reserve funds into those capital reserves in order to meet our estimated needs. As we've mentioned to this board before, we will be debt financing some of these larger expenditures in the future as they come together, and not using cash. We'll use debt financing vehicles. One of those vehicles will be a line of credit. We have looked at different debt financing options that are available for the projects and evaluated with a focus on cost, efficiency, and flexibility of the debt financing transactions. So in the past, we have used contractual obligation bonds for larger projects, and if those projects come together in the near future, we would also anticipate potential contractual obligation bonds. However, the most current need is around some smaller projects, smaller capital projects, some technology projects, and some furniture, fixtures, and equipment. And the line of credit gives more flexibility for smaller draws on an as-needed basis. And we are proposing that we execute a line of credit, there's no action tonight, in the amount of $10 million. There's a lot of information in the memo that we provided. So I want to talk a little bit about the capital reserves that we have upcoming for 2020, or what we anticipate, and that the focus of the line of credit would be on that technology and equipment line. We have some upcoming significant needs in that area and would anticipate using that flexible line of credit for those. Also estimated in our capital expenses is continued investment in clinical services and in eastern Travis County areas, as well as throughout the county. We also anticipate, I'm focusing on the second column, the estimated FY20 capital expenses. The campus redevelopment, you'll see in the notes, really is primarily the investment in the Red River realignment. We are still anticipating that project to move forward. As I mentioned, the technology and equipment needs, and then general facilities improvements. This might be facility improvements to existing clinics or enhancements to some of our leased facilities to improve that clinical space. So overall, we're estimating potential capital needs of $25 million in FY20. I also have shown you a longer-term look. Again, we don't have a significant number of approved projects, but we have a lot of planning going on, a lot of great work. I think you're going to hear from my colleague Larry Wallace about our continued work for clinical service expansion. And if you look at this, again, it shows for FY20 that the long-term capital needs for 20, we're estimating approximately to be $25 million. And then we show you that, based on what we know today, how much of that we might debt finance versus pay cash for. And looking at the longer term look, if you focus on the clinical services, eastern Travis County, you'll see that, as I mentioned, we are planning for 2 to 3 clinics. Some might be medium-sized, and some might be a larger health and wellness center. And so we've put those planning dollars in there as just a placeholder to see that we may have that longer-term need. That would, of course, be a different discussion about contractual obligation bonds in order to debt finance that. So I just wanted to give you an update on the long-term and FY20 needs, as we will be coming back to the board next week with the line of credit and what we've referred to in the past as a reimbursement resolution, and I believe you all have executed those in the past. That reimbursement resolution would be a resolution that allows us to reimburse for any expenses that are incurred in a time period in advance of that execution, just because the timing of the debt financing might not line up exactly with the expenditures. So with that, I'm happy to answer any questions about item 1 or 3.
Manager Jones?
I just have one question. Under tax collection, under the proposed budget, 1.8 hundred, what's involved in that actually?
So we actually, it's predominantly 2 things. It's Travis Central Appraisal District fees, and then fees to the tax office for the collection service. Those are our two predominant expenditures in that area. So we,
We contract with them, I mean, we pay them to be able to facilitate
Mhm.
that on our behalf.
yes, and it looks like about even, but the appraisal district, there's fees associated with that, and then there's fees associated with collecting the taxes.
Okay, all right, thank you.
Any other questions, managers? Seeing none, this is just an informational item. No action is necessary.
Thank you.
Agenda item 2, discuss and take appropriate action on the healthcare service delivery expansion in eastern Travis County, including project timeline. Mr. Wallace, thank you for coming.
Good evening. I'm here to give you an update on our efforts in what we have designated as our priority communities. You've heard about this throughout the year. Keep in mind, this presentation will not talk about Manor, Pflugerville, or Jonestown. We have services already there, and it doesn't mean we're not going to do more. We will. But tonight, I'm just talking about the priority communities and projects that you've heard about. This work falls under our strategic initiative, Access to Care. We talk about people, place, and geography. I'm talking about place and geography in this presentation. Our program design determinants when we move forward to implement these services, which will include multiple providers, primarily community care, and one is the UT School of Nursing. We will take into account what we heard from the community as we roll out the programs. We are data-driven, but we also listen to the community, and we have a number of ways of getting that input. One of the things we heard is we need services beyond 8 to 5, Monday through Friday, and so as these programs are developed, that will be taken into account. We also listen to our clinical partners because they're the ones that's actually providing the care. And we understand that health goes beyond just a doctor visit. And we want to consider the complementary services that help manage the patient populations. So our partner input is very important. And we are heavily leaning on clinical leadership as we identify social determinants of health. Clearly, one size does not fit all. As we look at the different projects, there are various solutions. We talk about Del Valley. The zip codes that falls within our work is 78747, which is Creedmoor, 78719, which is Elroy, 78617 in Garfield, 78742 East Del Valley, and 78725 Hornsby Bend, Austin Colony. The area that we're talking about exceeds 135 square miles. Geography, so take that into consideration as we try to bring solutions to this community. Our approach going forward is how we manage geography is we will approach our work in regions. We'll have a northern region and a southern region. As we spread out, it's virtually impossible to try to manage everything just with one single point of service. So you'll hear more about that later. But in the Del Valley area, we have multiple locations that are planned. On the map, you'll find ESD 4, which is Hornsby Bend, ESD 11, which is Kellum Road. You provided your approval just a few days back. We do own land. We call it the Daily Track, which is available for future development. And Community Care plans to build another site within Del Valley. And we still have the Travis County location that continues to operate. So for us, economies of scale and scope are very important as we move forward, as well as human resources. Another thing that you'll hear us talk about is responsibilities. Central Health will be responsible for asset management. Community Care will be responsible for operational management. The solutions that we utilize include brick and mortar, transportation, technology, mobile services, other things like home visits, and other non-traditional models of care. Our implementation planning will be a team effort. We'll have soft openings similar to what we did with the mobile unit. And our goal is to really have an effective rollout of all these services. So you have a map, I think, that you all are looking at, and I'll walk you through it. We'll start with the current operations, and those are in orange. And let me say this, mobile is not the end all. Because we use mobile services doesn't mean we won't do more. It's dependent upon utilization and demand, but mobile is a great way to get started. And about 90 days ago, I think, is when we began employing mobile services. And currently, those services are provided in Colony Park and Creedmoor. It serves Barbara Jordan Elementary School, also Turner Roberts Recreation Center, and the Creedmoor Community Center out in Creedmoor. So those are the 3 areas that are currently being served through mobile services. We also, under current operations, have the Dale Valley Health Center. And I would like to just bring you up to date, checking our numbers from this is the second year. Community Care has almost doubled their visits from last year to this year, and they're open 3 days a week. We tried to get more time, but that's all we could get. But that particular operation is really at capacity, which shows that there is a need in that part of Travis County. And there's one that was omitted, the Northeast Health and Wellness Center, which is located at Overton. It is not listed, but that should be an existing operation that we have in play. Our future developments are in blue, and they're numbered. Number 5 is ESD 4, Hornsby Bend. As you know, we have a prefab modular that will be placed there, and the expectation is by the end of the year, we expect that to be there. That will be operated by Community Care. The number 6 is ESD 11, Kellum Road School of Nursing. That's the one that we had talked about a week ago. And we've signed off, and now it's into the hands of Chief Bailey and others. We felt like Holly worked very hard. I'll keep referring to her because she spent hours on this deal. We brought it to the point where we're satisfied with it. Now they have it, they're looking at it. We may have to come back with just some slight modifications on timing, things that we would consider insignificant, but just wanted to put you on notice. So at the next board meeting, we may need to come back with some additional information on that particular project. As you know, under number 7, we purchased the Daly track, and that land is available. We want to see what happens at ESD 4 first. We will track utilization and see what happens. Once we have experience, we understand what the demand is, then we can talk about building something. We don't want to get ahead of ourselves, and so I think this is a great way for us to get started through the project at ESD 4. The next one is the Colony Park Master Plan, which is number 8. We continue to work with the City of Austin. We are making what we believe good progress there. And then one that's really not in our priority list, but because we are helping, it's number 9, it's Community First Village, it's just there. That's not on our nickel, But they are looking to us for technical support. Community Care will be a primary operator there, and so that's just another site. Then number 10, Community Care, and that's not on here, we need to find a location for their new site. So these are all future developments in Del Valley. It's no less than 4. It could be as many as 5. And so there is activity in that regard. So that pretty much concludes my update, and I'll answer any questions if any of you have. Mr. Reber.
I just want to start by thanking you for all of your hard work. As you know, this is, I know, a priority for you and staff, but it's a priority for this Board of Managers, and so we're really appreciative. You said on number 7, the daily track, you're going to monitor first what happens at ESD 4. Are you going to wait till that's at capacity, or what's the plan there?
Exactly.
What?
I'm sorry, Mr. Chair.
Yes, please.
Let me fill in the gaps. I'll just answer on a larger perspective. But in talking with Community Care and also working with other clinical partners at other sites, one of our lessons learned last year was that before you just get out there and do the real estate piece of it, you really have to get to know the patient population. And just because you might be providing services out there at clinics that are closer to the urban core, once you have a presence out there, that's a whole different experience. And so I think as they, establish those relationships with those patients and get direct patient feedback, then that's going to inform this process, as Mr. Wallace mentioned. So that's kind of the overarching, philosophy here. It's not that you wait till something's at capacity or not. Having said that, there's also the process of just getting started on developing the daily track, for instance, and there's a number of permits that you have to get because we've got to develop it with basic infrastructure. It doesn't have water and sewer to it, for example. It's a raw piece of land. So you have to start that process in the meantime. So you're not completely flat-footed, so to speak, but there's some sequencing here. But is there anything
No,
more specific
Thank you.
that you
That's
want?
helpful.
That's
Thank
fine. Yes.
Thank you, Chair. Thank you, Mr. Wallace. Really appreciate it, and thank you, Holly, for this work, and Mike and everyone else. I have a couple questions. Now, I know these are the future plans and what we have in place and what's currently taking place. Can we at least have a simplified table that we can share with the lay audience, who can really understand where we're at and what services and the timelines that perhaps we expect the services,
Sure.
and who's operating those services? I think that it's really important. As you know, we voted, I believe, our last meeting for ESD 11. Yes,
Right.
we put in financial. We put in some funds there, but yet we're not operating that
Right.
clinic as well. So I think it will be helpful
Okay.
for the community and lay audience to know where and what is there. Now, I know we're talking about healthcare expansion in Eastern Crescent, but also we also want to be mindful of other communities. I know Dove Springs, and it's a high need, and I wanted to see where we're at. Especially, I know the city has now a partnership with the Park and Recreational Center over there. They just recently voted on an agreement. Do we have any? Where's our piece of? I don't know. Where is our involvement in that community? And I feel it needs our attention. Are we part of the discussion or not?
Yes. Well, Community Care is. And right from the beginning, both those projects that were being identified, Runberg and Dove Springs, in the beginning, Jason and I, we met with folks from the city to express interest. And Community Care remains interested in what happens in Dove Springs. And perhaps at their next opportunity, Jason can maybe give you some of the details around that. But clearly, they are at the table to be a part of what happens in Dove Springs.
And Runberg, are we also planning?
Well, Runberg, I think there was a change of a plan as far as the city is concerned. But in both of those opportunities, I would just say community care was at the table and willing and have expressed interest in participating.
I just want us to be mindful. I know certain communities do not come and we don't hear their voices. I want us to also be responsive to deliver the care to those who really need it, who do not know, have a way to express their opinions or their needs. So those who their voices are not here present, we want to make sure that we're really addressing them and we're not just focusing on the noise or the loudness of others. I just wanted us to be mindful of all the community, everyone else that needs our care and services as well. And
Okay.
thank you, appreciate it.
Mr. Chairman?
What's your?
Yes, so I see that you have passed out the existing document to us that we have that shows the healthcare services that we're planning, right, and the locations, and there appears to be a timeline on the back. Is this on our website also where people can access it from the Central Health website?
No, but it can be
I would just,
easily.
I would just
Yeah.
suggest that we get, this is an excellent document, but that we add this to our website right away. And we may also want to, through social media, make people aware that it's available once we have it up on the website.
And if I may comment related to that, and also we need to have it in Spanish as well, because
It is.
we do, okay, just want to make sure that is addressed.
And I'm assuming both versions will be up on the website.
On the website.
Right.
The information's there, but what we can add is as a downloadable.
That would be perfect. Let's just add it as a downloadable and let people know that. Thank you.
Yeah, I have a couple questions. Thanks very much, John, with the board, and thank you for your leadership and your efforts. A couple of questions. First one is, from a philosophical point of view, we have currently two major health facilities, one north and one south. Southeast Health and Wellness and
Northeast.
the metric one. In terms of planning strategically along those lines, I guess the question we as a board probably needs to address is, are we going to be able to look at major health and wellness centers that will service the entire county and then reduce our footprint in the smaller ones in order to be able to have capacity to service the whole county? Or we're going to sort of have these health and wellness centers sort of in regions of the counties and still have smaller locations? And so that's the first question I raised. And
Okay.
if you could answer that, then I have
Sure.
a follow-up.
We, as I had said earlier about a regional approach, it's, I think, important that we employ a system of care that is responsive to communities, but yet we know that we cannot build a health center in every neighborhood. We talked about the hub and spoke concept some time ago. The hub being your large, we call level one health centers, like
Right.
Southeast Health and Wellness Center, Northeast Center. And we're going to propose that we have another one of those, maybe at the Colony Park location, because Manor and reaching toward Pflugerville. So strategically, if we align our level one centers, which have all your major diagnostics, have all your specialty care, dental, pharmacy, all of that, I think we will always need the smaller clinics because people may not be able to get to the larger ones. And so as best as we can, I think the model really uses both. So the smaller ones, neighborhood focused or based, and as long as you have enough visits and utilization to support it, normally those sites are going to be one or two practitioners. They can also be used as urgent care sites going forward. So there's a way to repurpose all of that to support our total system of care. But one size does not fit all,
Right.
as I had said earlier.
Yeah. And I appreciate that because I think that's to the question my colleagues asked about some of these other areas around town. I think those are the kinds of response we need to provide. Yes, we'll have larger ones, but we'll have some community ones that will also be part of the spokes. I mean,
Hub
whatever
and
that is.
spoke.
Yeah. The second question goes to, if you look at 78742, it's a very unique zip code and has, I keep reminding, some of the highest morbidity and mortality in the county. And is very isolated. And it's going to be difficult for those individuals in that community to get to any of these locations that we have. I think the previous person who spoke about in the public hearing earlier, Ms. Vanessa, got her last name, but she talked about Eastern Del Valley. So the question is, have we looked at how are we going to serve this area? And for those who may not be familiar with that area, and I always illustrate it, it's the area over behind the landing strip, for those who are familiar with that. And I don't know if you've had the opportunity to drive over there, but it's really an isolated rural area that really is neat. And even though it's not a very large populated area, it does have some critical needs over there. Senior, elderly population, poor population, primarily Hispanic population. And I'm just wondering, particularly as we look at Del Valley, are we going to do some outreach to that area in particular? Because with what we currently have, there's the freeways prevent it, the river blocks it off, the 183 isolates it as well. So many people don't even realize that that's part of the community. So I just encourage you, as we look at Del Valley, we do something with regards to that particular area.
Duly noted.
Larry, was there anything else you wanted to add to
No.
Manager Jones's question? So I want to tag something on to what Mr. Wallace said. You know, as we're looking at regionally, how do we set things up? How do we strategically position the healthcare district, for example, buying real estate, so that we can scale up however it is that we need to and do that expeditiously and also cost efficiently? So those are a couple of considerations. But another overarching consideration is, how does all this blend in with our access to care work? So if we're looking at just the basic building blocks of a healthcare district in terms of providing primary care, specialty care, post-acute care, all of this has to be coordinated together. And that's one of the exercises at the management level that we're going through now, which is, you know, we need to be able to support Mr. Wallace and all those that are involved in pushing out to areas in eastern Travis County, in areas like Jonestown as well, but then also coordinating in the planning for the levels of care that are needed for the population. So this is somewhat agnostic with respect to geography, but again, you've got to have that planning element at the table as well. So that way we're looking at this from, you know, what does the overall capacity really need to be? And not just in terms of numbers of doctors, but by line of service, for example, or by the category of service. So this is a pretty expansive mental exercise that we're going through and growing up, if you will, as a healthcare district.
And we're faced with the impact that gentrification is having on this community as we develop that strategy, because much of this eastern movement is being driven by the impact of gentrification. So
Zip code matters.
Right.
And as I had said earlier, we still look at data. So the areas that you are talking about, we certainly have information, and that could drive some actions as it regards to solutions going forward.
okay, thank you.
Manager Plaintiff?
Oh, thank you, Chair. In regards to this document and the services that we have currently available for Eastern Travis County residents, is it possible to disperse some copies at schools and public places for parents and families to have access to those who don't have access to the internet?
Yeah. Yes, the answer is yes. And I know that if Ted wants to come over, community health workers are now part of our DNA. And so that's a resource that will be used. And I think the intent is for those people who are helping us to reach out into the communities. They can certainly have this information and give it to neighborhoods, communities, schools, any place that it's needed.
When?
It's already happening.
Okay, so, terrific, thank you.
Any other questions, managers?
Thank you.
All right. This is an informational item only. No action is necessary.
Thank you.
Thank you, Mr.
Thank-
Wallace.
thank you, Mr.
Appreciate
Wallace.
it.
Thank you.
Thanks for your work.
Agenda item 4, discuss the 1115 Medicaid waiver, delivery system reform incentive payment, DSRIP projects, community care collaborative, including healthcare delivery arrangements and other interrelated community partnerships. Ms. Crowley. Monica? I don't see.
Sorry.
Okay. I announce that the board is convening into closed session to discuss agenda item 4 under section 551.085, Texas Government Code governing buying of certain providers of healthcare services. So it's September 11th, 2019. It is 7:28. We're coming out of closed session. No action will be taken on item 4. This is an informational item only, no action necessary. Agenda item 6, confirm the next regular board meeting, date, time, and location. Second public hearing on budget and associated tax rate, followed by the next Central Health Board of Managers meeting, is scheduled for Wednesday, September 18th, 2019, at 5:30 p.m. at Central Health Administrator's Offices, 1111 East Sarasota Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept the motion for adjournment. All in favor, say aye.
Aye.
Motion passes.
Thank you, members.
Thank you.
So,